My name's Anthony Clough and I'm a bariatric or weight loss surgery specialist. Today I'm going to talk about body contouring surgery after massive weight loss. A common concern from weight loss recipients is regarding the body changes that will occur after the weight has come off. Commonly, patients may develop loose, redundant skin around the abdomen, upper arms, thighs, breasts and buttocks. Unfortunately, no amount of exercise or toning can get rid of the skin. Loose skin can cause excessive sweatiness, rashes, infections, and difficulty finding appropriate fitting clothing. In addition, it can impair your ability to exercise and movements and can make patients feel highly self-conscious. Many patients will end up needing to undertake surgical procedures to remove the excess skin and thereby complete their body transformation journey. Pretty much any area of the body can be operated on to deal with loose skin, and the surgical approach and goals are different depending on which part of the body we are looking at. The most common procedure is abdominoplasty, commonly known as tummy tuck. This is a major procedure to remove excess skin on the lower abdomen and tighten the underlying muscles. The operation entails a long cut at the lower extent of the abdomen to enable the skin and fat layer to be freed up completely all the way up to the ribs. This cut will form the main scar, which goes essentially from hip to hip, but should be hidden underneath most pants and skirts, just like a caesarean section scar. Incidentally, any low scars, such as from C-section, hysterectomy or appendicectomy, will be removed with the loose skin. Once the skin and fat is detached, the underlying abdominal muscles are tightened because they have been previously stretched out by the underlying fat. Once this is done, the skin is stretched firmly downwards and the excess amount removed. Sometimes this can be a handy little bit of extra weight loss, perhaps a few kilos depending on the individual. When the skin is pulled down, in most cases the belly button will end up way too low, often in the area of the resected skin. This means it must be repositioned back where it belongs. However, there will always be a circular scar around it because of this. Finally, the layers are reconstructed and everything sewn up under a certain amount of tension, so a binder is positioned around the lower abdomen for support. Recovery can be up to 6 weeks until a full range of physical activities can be undertaken, although walking and basic household tasks can be managed within a few days of the surgery. Are there any problems that can occur after abdominoplasty surgery? Tissue-related issues such as infection, bruising, fluid buildup or focal wound breakdown are quite common. Generally speaking, these will resolve with time. The new belly button has less blood flow than it is used to and takes longer to heal than the main wound. In about 5% of cases, it can die completely. Note that certain individuals may be more suitable for other variations of abdominoplasty, such as a 360-degree procedure or other types. Arm reduction surgery, also known as brachioplasty, is a bit more straightforward. A portion of skin with a little underlying fat is taken from each arm to remove the redundant dependent section. Usually, in cases of massive weight loss, the cut extends from just before the elbow right back into the underarm. The resulting scar is essentially a straight line, extending for most of the length of the arm above the elbow. Depending on its precise location, the scar may not be visible except in certain movements. Scars can heal differently depending on the individual and how much tension is on it. Sometimes a thin silver line will be the result, other times the scar is much thicker and wider. The recovery from brachioplasty surgery is quicker than abdominoplasty. However, the arms will be wrapped in crepe for up to a week to prevent swelling. Uncommon adverse effects include small areas of numbness due to nerve damage or swelling from excessive tightness. Sometimes the scar itself may cause tight areas called contractions, however this is uncommon. There are many other body contouring procedures to deal with sagging breasts or buttocks, thigh redundancy or other miscellaneous problems. Unfortunately, the limiting factor for many people is the cost of these procedures, as health insurance often does not cover them, as they are seen essentially as cosmetic. This you will need to discuss with your clinic. Thanks for watching my video on body contouring surgery after massive weight loss. Please watch out for my other videos on the weight loss surgery procedures to keep you up to date on this rapidly changing field. My name's Anthony Clough, and you can find more information on the procedures at my website www.anthonyclough.com.au.